Hi, my name is Dr. Iraj, and my specialty is autoimmunity. Today I'd like to take the opportunity to speak to you about a normal immune system and an autoimmune system, the differences and how they work. Let's start with a normal immune system. When a normal immune system has been challenged by a pathogen, a bacteria, or a virus, we mount an immune response to this challenge. And most often than not, very effectively, the pathogen, the bacteria, is destroyed, and the immune response is then returned to normal level, back to normal status. However, in the autoimmune condition, there are a number of issues. Firstly, in an autoimmune condition, the immune system recognizes some of the self molecules as foreign and as pathogens. The other, it loses the ability to return to normal levels by itself. So, in the autoimmune case, if the immune system is challenged by a bacterial, a pathogen, and we mount, or the person with autoimmunity mounts an immune response, the immune response remains high, because once the pathogen has been deleted and gotten rid of, the self molecules are being seen as foreign entities. And the immune response continues activated, attacking self molecules, resulting in the manifestation of the condition, whichever that may be. Now, there are many types of autoimmunity, starting with the common ones: eczema, psoriasis, rosacea, atopic dermatitis, to the more serious one, such as MS, lupus, and many, many, many more. So these two are extremely difficult conditions that need to be treated. So how do we treat autoimmunity? One of the first line treatment for treating such autoimmunities as psoriasis, eczema, rosacea is to dampen the immune response. It's by using a steroidal product, cortisone, to bring the immune response down. Now, this is a holistic approach. So whether it is a capsule or is a topical ointment cream, you essentially bring the immune response down. You're shutting it down, and once the immune response is shut down in that area that you're treating, the condition returns to normal, because the immune system is not attacking the immune herself molecules, and the rash goes away. However, as soon as, and more often than not, when you stop using the steroidal product, the condition returns, sometimes worsening. The other thing about using a steroidal product is that the body actually gets used to it. And in some instances, there becomes a dependency on the steroid. So not only does the body require more and more of the steroid to calm or bring the immune response to lower level, the actual skin or the body itself become dependent on a steroid, and that in itself exacerbates the situation. The other mode of treatment are some other drugs that are currently being developed and are on the market. These are biologics. These are invariably antibodies to different molecules or mediators that are part of the immune response. So, for example, there are antibodies, biologics that are targeted toward TNF-alpha, one of the immune mediators known to affect or cause the rash associated with psoriasis and eczema. Also, there are other molecules. There are interleukins, and there are many of those. And some of those are more specific, associated with the condition. I understand interleukin 12 and interleukin 24 are associated with psoriasis, and companies are developing antibodies to these interleukins. Having said that, all of these are essentially just treating the symptoms. not really doing anything effective. All of these products have side effects. Some of them can be quite dangerous, and in many instances, some of the patients have claimed that the side effects have been worse than the treatment itself. So I'd just like to bring to you the possibility that we can treat these conditions without the use of steroidal products or non-steroidal products which have horrible side effects, or the biologics. I used to be head of renal research at the Children's Hospital in Sydney, Australia, and I discovered a molecule produced by the immune system itself. This molecule signals the immune response to return to normal level. So we have now developed a methodology in which to incorporate the precursors, the basic molecules that make this active compound, into a number of products that we're using for treatment of psoriasis, eczema, rosacea, arthritis, etc. Now these molecules presented to the patient's or the person's own immune system are converted into the active compound. The person's own body decides how much of the active molecule required, converts that, and naturally brings the immune system under control. We have had extremely successful studies and trials done by people, and in many, many instances where there have been no treatment successful for these people, they've used Endor products and have been very happy with the outcome. Thank you, and I hope this has been helpful.